Are you interested in understanding GLP-1 medications like Ozempic, Wegovy, or Mounjaro? Then join us on the Plus Sides, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, or Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sides, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together. The Plus Sides Podcast, because every story deserves to be heard, every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides Podcast. You're not alone. Welcome to the Plus Sides Podcast. I'm not going to do an intro because if you don't know me, it'd be weird because this is season 2. Sup, I'm Kim. This is the Plus Sides Podcast where we talk about obesity, related diseases, and disorders. It's a health and wellness podcast where we focus on healing and learning and growing. Oh, I know it sounds all kumbaya, but that's because it is. Okay. I'm snarky. I haven't slept good. I had a cold. It's going to be fine. Question before we get started. Do I look like Princess Leia with these headphones on?
Oh, I was going to say, no. I know.
You feel like big
you don't have brown
rollers.
hair nor brown eyes. You kind of threw me off with that. I was like,
does it not? I feel very Star Wars.
They look like the buns.
The two buns.
The buns.
I don't think my head
I don't think so.
is the right size for these kinds of headphones. I feel like I need smaller. I would like recommendations from the audience. Thank you. Please put it in the chat. Mm-hmm. Anyway, that's who I am. That's what it's about. We're so glad to have you. Yay. This is Kat. Kat, who are you? What'd you do? Why are you here?
I am Kat Carter 7 on the TikTok. And I have lost 66 pounds on Mounjaro. I will
66?
66?
Yeah, I was at 65, right? 66.
You were like 60 for a minute.
But I've been on my life on the stall. But
food.
now my experience is, since working with the trainer, my body has been shrinking and my weight has been staying the same. And I will take that.
Hell yeah. I'll take it too.
She's making my legs, my hips, and the gluteals look fantastic.
Yeah, it'd be popping.
It'd be popping.
A little bit of gun show.
Yeah.
Oh my gosh.
I love it.
Oh my God, Kat.
Waist. Right? Thanhanks, Claudine.
Whoa.
Yeah, you should see her. She's like a tiny little muscle, teeny weeny little lady.
A teeny weeny.
Tiny.
I love very mighty, tiny people. I just think it's so
a lot of fun too. Yeah. She's fun. Yeah. We curse a lot. We cut up.
That's fun. That's good. Yeah. I just know afterwards, usually like I'm so exhausted. Listen. So cool. We're so glad to have you. Yay.
I'm so glad to be here.
Janine, who are you? What do you hear? What's up? How's it going, JT? Who are you?
Well, I am the Janine on the TikTok. And the TikTok. And I'm just hanging out with you all because I nerd out on GLP-1s and
you do.
Like health and wellness and all that good stuff, because we need our knees and we need our health.
Yeah, we do. Gotta have the knees.
Garner style.
Yep.
Yeah.
Garner style. We love you. We need our knees. Yeah.
Yeah. Totally.
Yeah.
So good times. So we're going to talk about hormones today. A lot about hormones. And we're going to talk about obesity. And we're going to have our community story. And then we're also going to have one of our clinicians join and be able to talk more about the clinical side of the GLP-1. And it'll be grand because we're going to learn and understand why these things are changing our lives and why we can look back and go, holy crap, I don't think it was my fault. Because if it was, why is it all working now? Like all those things I used to do, I can do now and apply to my body and my life.
Yeah.
And yet now and now I'm starting to function like a normal person and lose weight. Like I think we always talk about here that you treat the disease and weight loss follows. This is not a weight loss podcast. That's why it's health and wellness, because we focus on the health first and then weight loss follows. Yay. Huzzah. Cool. So that's what we're going to talk about today. And if I'm spacey, it's only because I just got my second wind. I haven't slept, but just be nice. And if I'm too weird, you won't see it because I'll have Lydia cut it out. All right.
There are a lot of people getting like their colds right now with the change of the season.
Yeah.
A lot of folks are getting sick. So
I think I've only been sick 3 times in 14 months, and they were very pithy, which is like a big deal. I think, that's a lot since I just think I just work again, like working like I was supposed to, but this was only about 48 hours. And then I woke up, and after the medicine, woke up and I just couldn't go to sleep. I'm pretty sure that's because of the pseudoephedrine though,
Probably. And then the whole season, like Kat was saying, the whole season change.
Yeah,
it's like affecting more people this year, it seems.
Yeah. Yep. I don't know. Maybe we're just talking about it more because on the internet all the damn time. Oh, real quick, water check. Hey, you see this cute little Stanley Manjaro looking water? But anyway, listen.
This one's been put in the dishwasher, as you can see.
I can tell.
Yeah,
I know you tried to pretend like that was all the gym. Nice.
Oh, I've dropped it many times too. I'm a klutz.
I know. But anyway, it's cute. I feel like I'm holding I need to my exercises with Kat, Look, if you get this, if you want to get this, it's in our link. Yeah. And you can get $10 off.
Podcast
and podcast 10. And some of it goes to support the podcast, which is great because we're all just volunteers. Yay. Anyway, let's get started, eh? Ready?
I think so.
All right. I'm going to invite in our community guest. Here we go. Hey, Vicki.
Hey, Vicki.
Hi. How are you?
Hi,
How you doing?
Good.
Vicki, you have 2 of my favorites going on: a really great haircut and animal print. That's
Her hair is freaking
I know.
fabulous.
Animal print's my favorite. That and pink.
I always remember, like,
That
from
hair.
the beginning, I love her hair. I love it.
Thank
It's
you.
beautiful. I'm
Easy.
jelly. I have to do so much crap in my hair. Yeah, that's what Kat says. Well, we're so glad to have you. So one of the things that was important to us when we started this podcast is that, a lot of times on the news and stuff, they're always having to cut and edit things and fit it into their timelines and their narratives and their agendas. And like, we don't have to do that here. Legitimately, our agenda is to have people hear your story and go, that sounds like me, and go see their doctor. And legitimately, I get a message every single episode from somebody that says that. And when they say it, I will send it to you. Cool. So I want you to take the space and tell your story and just think, if there's someone out there like me, what do they think they need to hear so they can realize that it's okay to, get their disease treated and there's help out there,
Well, I looked up, I couldn't figure out how long it had been since I had my hysterectomy, and it was 2007. So it's been a while.
Yeah.
But that was a rough way to go. I had a doctor that I had the hysterectomy. She nicked my bladder during surgery. And I went home with a catheter for a week, went back for my follow-up, told her I wasn't feeling right down there. She says, oh, we're not going to do another surgery, and just kind of sloughed it all off. Put me on Premarin. And
what's that?
It's a hormone. It regulates your hormones, as far as I know. I never really checked it out. I just did what I assumed.
Just did what they told you to, right?
Yes.
Yeah, I get it.
And probably about 6 years ago, I was upset with her because I felt like I was neglected and she didn't pay any attention. I think she made a mistake during surgery and she just wanted me out of there.
Yeah.
So I've had 2 other primary care physicians. I always select women because I feel like they understand women better than men. I don't know if that's probably not true, but I always felt more
I get
comfortable
it.
with a woman because you
Yeah.
figure, when you're not feeling good, they understand your period
Sure.
and,
Yeah.
all that, your hormones and all that. Well,
Sure.
this primary care that I have now, she took me off of it and said I'd been on it way too long. And I couldn't understand why anybody else hadn't taken me off of it. And so far I've been okay, but it was just a rough way to go. From 2007 until a year ago, the weight issue was a big deal.
Yeah.
I think my highest I ever got up to was like 287 pounds, but it was just, I did everything possible to try to get it off. And you'd get it off, then it'd come right back on.
Sure.
And so I do have a good doctor now that's taking care of me,
Oh,
and
that's good.
I think understands that. But I'm 64, and I don't think I was really educated enough in that area as far as the hormones and that type of thing. I think my mom, she just accepted things like they were and didn't really share a lot with me about that. And then to go to a doctor that just really, I don't think honestly cared. So
Yeah.
Wow.
that was that's kind of my story on that.
Yeah.
I'm just
And
thankful I
then
have a doctor now that takes care of me.
me too. What made you talk to your doctor about well, you started on Manjaro, right, Vicki?
Yeah, last July. That's been an up and down thing too. I don't know if you guys know, but I had insurance
do, but
issues.
Oh,
Yeah.
Yeah.
I remember the
My
story.
benefit manager
Yeah.
was Novitus, and they absolutely will not let you use any type of discount, anything. So after I went through all of that and trying to get it changed insurance, then they put it on their formulary, and it was going to be like $60,000 deductible to do it. I said, well, I'll never meet that. So then I started to get Ozempic from Canada, which worked out great.
Yeah.
And then all of a sudden, none of Canada will let you have it. So then I decided just to go ahead and pay cash and do the Ozempic here. And I was on it a month. And the whole time I was on Ozempic, I didn't feel like it did anything for me. I did not lose any weight. I maintained my weight. And so then I took 2 months to be able to get my refill on the Ozempic here.
Yeah.
So then I decided to just see if I could just do the Manjaro, pay it out of pocket. I'm doing it on Ozempic. So I've been on it. It'll be a month Thursday.
Oh.
So I'm back on it, thankfully.
Yeah.
It's just a pain that I have to pay cash for it, but
It is.
it's helped.
Real quick, I know it's not like go ahead, Vicki. Go ahead.
I can just tell
Go
a
ahead.
big difference between Ozempic and Manjaro.
How so?
I just feel 100% better. My mental clarity, I feel like, and more energy. The appetite suppression, I feel like, is so much better. I just feel good all around. I mean,
That's
I'm
great.
just so much better. I think my
I'm so
husband
glad.
even knows it too.
Yeah. Well, I mean, I hear those are important sometimes, so that's good.
All right. Just a little bit.
Are you
Tiny
open
bit.
to some questions, Vicki? Is it okay
Sure.
if I ask you some questions? Okay. So I'm curious, in terms of throughout your life, was weight ever an issue, or is it just when you had the surgery and things went haywire?
It was about the time I had my hysterectomy. Everything just kind of just exploded.
Okay.
And
So
it
before that, you really
it
never
was
struggled
so
with weight,
hard.
even 10 pounds or anything?
Yeah, and it wasn't really an issue for me. It really wasn't until then. I mean, I had 2 kids and was managed to get the weight off with them, and then I had the hysterectomy, and it just went downhill. I mean, it just I could tell. When I think back, it's like, yeah, it was a big deal. And I would do everything. I mean, I would walk, I would exercise like a crazy person.
Yeah.
starved myself. At one time, I was on a 900 calorie diet.
Oh my gosh.
And
Yeah.
done it
Yeah.
all.
Yeah.
Same.
Yeah.
It's crazy.
Yeah. I think it's interesting. Like we've had people on the show that have struggled with obesity since childhood, some that didn't struggle until college, and then some who had never struggled until like whatever that one thing was that happened, you
Mhm.
know? And
Right.
it's been like, it's just been all across the board, you know? And I think like, I want to talk more about this, but I think we have to consider preventative medicine. Like, I don't think that people are asking that question enough. Like, we had one girl that was on our show, Vicki, and she struggled with maybe 10, 15 pounds, like diet culture bull honky. So we're on YouTube. And, you know, like basically like just teenage and college. And then she lost her mother. And then when that happened, sorry, because sleepy. And then when that happened, she gained 60 pounds and all of a sudden she's obese. So it's like, I can't help but wonder, what was that? What was that underlying thing? And if we had had medicine then to treat her 15, 20 pound thing, would she have ever become obese? You know, or people who would then become obese and then become maybe they would ever become a type 2 diabetic, you know? And I just think like, I know it's very taboo because there's not like a lot of evidence around this right now, but I think we have to talk about it. Like if people can take this medication to
Mhm.
prevent, like, you know, type 2 diabetes, why can't they take it to prevent obesity? You know what I mean? Like, why not? And I just think that we should start questioning things, you know? So that's why I wanted to know, like, if it was ever a thing for you ever, you know? Um, and even if you had started gaining weight then, it wouldn't have been so great if like you had had this then, and then you could have
Oh, yeah.
never, you know, been where you are, right?
Right.
Like, think of all the years,
Oh,
all the
yeah.
years.
I'd have been much happier.
Sure. I get it. I get it.
Yeah. It's
Yeah.
Much happier.
Well,
but
I know you've had a lot of struggles with health insurance and stuff. Like, I know it has. Like, you've been very open about it, which I'm glad of. Um, I just want to make sure like you've had an opportunity to tell us anything that you wanted to share. Um, you know, I think sometimes when you're choosing weight or maybe like moments when you were thinking, hey, maybe I shouldn't just be listening to this doctor without asking questions, like something happened where you were like, I should go see someone new. And I feel like that mental piece and that questioning piece, like what was it? What made you think, hey, I should like, was it because did you see Manjaro advertised, or were you just like, it's just time to go see another doctor and see what's going on?
I did. I saw it, and she had actually put me on Phenermine,
Mm-hmm.
and I
Okay.
couldn't take that. That just keeps me awake. I mean, it has
Yeah.
suppressed it for me. It suppressed my appetite for a few hours, and then I was wigged out, and I couldn't sleep. Blah 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 blah.
Sure.
Why I just couldn't take that.
Yeah.
And then I saw it, and I text her and I said, "Can we try this?" And she's like, "Oh yeah, sure." And
Sure.
she's all for it. She had
That's
just
good.
had Lily representative come in the office that day that I text her,
Oh,
and she
Oh,
says,
wow.
"By the way, we will." So I was kind
yeah.
of the first person in her office to do it, and she'll still ask me
Yeah.
stuff, you know,
That's
about
cool.
what kind of stuff. Yeah. Um,
Yeah.
but I
Is
tell
she a
you,
specialist or just a
she,
regular doctor?
she's a regular doctor. Um,
Regular.
yep, regular PCP. But I really think a lot has to do with finding the doctor that's going to help you. I mean,
True.
Yeah.
some doctors are in and out. You know, you just,
Yeah.
they don't really care to go the extra mile to help you. You know, give me a reason. Do do something, you know. Tell me why I'm
Yeah.
like this. Of
Yeah.
course, it's always been the eat less, move more, you know, that type of thing.
Mm-hmm.
But things
Yeah.
have changed. It's changed. People are
Thank
ready for
God.
the change. And yes, and there's so many new things coming out with this. I mean, it's just amazing, amazing
Yeah.
what the GLP meds are doing.
Yeah.
It is. It's
Definitely.
exciting to see. It gets a little scary sometimes, I feel like, because like, and I've talked to JT before, we're basically like, if you're taking this for obesity and not type 2, right? We know that this class of medicine's been around a long time, right? But the GLP-1 GIP, it's new and it's not approved just yet. During the time of this recording, it has not been approved just yet for the treatment of weight management. So, it's like we're early adopters. You know, it's like when you get that, it's like when you get that iPhone, the new iPhone, which I have on back order right now, and you get it, you know, there might be some bugs, but you hope it all works out. That's kind of what I feel like, you know, I
Yeah.
hope it works out. Seems to
Yeah.
be okay. I get a lot of questions, like, a lot of questions that are like, you know, what are the long-term effects? And I'm like, I don't know, but I know I could get 13 different kinds of cancer. I know I could probably have type 2 diabetes in a year, you know, like
Indeed.
I know that's all very, very likely. I know that my family gets, you know, has heart attacks. Like that's our thing. That's the thing that gets us, a lot of
Yeah.
them, you know? So,
Well,
you know, I think it's so much around that, like, I think preventative piece, you know?
Mm-hmm.
Yeah.
Yeah.
Go ahead, Vicki.
and people with diabetes type 2, they're taking this and they're not having any effect. They're taking it with no problem. So what's the
Yeah.
difference in me taking it and I'm not type 2?
Yeah.
So,
I agree. I mean,
people keep
that's,
saying,
we
oh,
have
there's going to
learned
be
about that.
something happen. Well,
Yeah.
they've been taking Ozempic for how many years now? We've not heard any issues about it. So what's
Yeah.
the big deal, people?
Plus
Quit complaining.
Victoza.
We're doing good.
Victoza was
Yes.
2012, right?
Yeah.
Like,
Yeah.
Agree.
and so I think that people don't realize these are nowhere as new as people act like they are. You know what I mean? Like they've been here a
Right.
minute. They've been helping people a minute. They do have long-term studies on Victoza. So I think I just think we have to like, and also what we've learned on the show, Vicki, is that like it's basically like an insulin resistant spectrum, right? Being either pre-diabetic or pre-diabetic or whatever it may be, you know? And so therefore I think that's why it works. And we've had doctors on the show that are like, if it works for you, it's because something was wrong. Like if it doesn't work for you, then that's not the thing that's wrong with you, you know? And I think that's just important. And so we're trying to talk about that. And we thank you so much for coming and sharing your story with us today. We
Well,
do
thanks
have
for
Dr.
having me.
Rudy on. And
Yeah.
we would love if you would stay with us. And if you have questions for him, you can ask him, which is
All
nice
right.
because one thing I've been preaching, hallelujah, in the GLP-1 universe and our evangelism, hallelujah, you know, is it's time to question our doctors. We have to question our leaders. We have to question our
Yep.
doctors. There's nothing wrong with it. You're not saying to them, I think I know more than you. You're saying, if you're going to be
Right.
talking about my body, I need to understand what's going on. Right. And there's nothing wrong with asking those questions and expecting to have them explain it to you. You know what I mean? And I
Right.
think that we all deserve a doctor like that. I really do.
Agree.
Because I look
agree.
back on my life and I feel like it would look very, very different if I had learned to advocate for my health much earlier. So thank you for being here and being a part of this and helping us try to create a movement around this so people can feel more informed when they make these decisions. We're going to go ahead and invite in Dr. Rudy and ask him some questions. Hey, Dr. Rudy.
Hey there.
Hey, Dr. Rudy.
Hello there. Hi, everybody.
I don't know how to not call you Dr. Rudy. Is it okay?
I love that name.
Okay, good.
Dr. Rudy.
Dr. Rudy, we're so glad to have you here. Welcome to the Plus Size Podcast.
Yes,
We would love if you would explain to us a little bit about what you do and how you help people.
definitely. First, I got to say, I just love the energy out here. My God, this is so refreshing.
Oh, so glad.
I'm
Thank
glad
yeah,
you
you.
like it.
my passion is nutrition, and I can hear passion everywhere. So that's amazing. So to tell you about me, so I trained. I'm originally from Haiti. Came to the U.S. to do my medical practice. I went to University of Florida for my undergrad major, and it was in nutrition. Not knowing I was going to go into this, but I always was interested in nutrition. Then I went to University of Miami for my medical degree and started working as what we call a hospitalist, meaning I worked in the hospital. I dealt with ICU care, emergency room, heart attacks, heart failure, acute medicine. And I have to say, I loved what I did. Western medicine is amazing at treating acute conditions, but we're really not that good at prevention or optimization. So
Yeah.
I was able to, thank God, me and my wife, who was also a nutrition major, we opened a weight loss clinic called A New You, because I really felt that it's not all about the number on the scale. It is changing the whole vibe.
Yeah.
And that was back in 2005, 18 years ago. And as I went forward into this, I started using, what we had available at this time, like Vicki said, was the stimulant type medication, the phentermine, diethylpropyl. The Brazilian pills were coming out. So, our tool belt wasn't that great.
Yeah.
Then 2014, I started using liraglutide, Saxenda, Victoza. Then 2017, Ozempic, breakthrough medication. In 2021, Mounjaro. And then you're like, wow, we're finally getting somewhere now. So that got me excited. And when I take a step back and I look at the trajectory of my career, I actually call myself on the TikTok, Dr. Rudy Best Life. Because I do a lot of things, and a lot of people ask me, "What's your specialty? Why don't you focus on one thing?" And my answer is, my focus is to help you live your best life, but whatever means necessary. Whether we have to use GLP-1, hormone replacement, nutrition, education, behavior counseling,
Everything, all that, right? All that.
Not one,
Yeah.
it's multifactorial. So, and the advent of GLP-1 medication has really been a true breakthrough in medicine. So I like to say that GLP-1 medications are the most important breakthrough in medicine since the invention of penicillin. That is how much I think about them.
I for sure feel the same way.
Yeah, I think so. Yeah, I could see that. Absolutely.
And we were talking about, as you said, that's been there forever. So I'm a primary care physician. I've been using GLP-1 medication for diabetes since 2005. So back then, when we were using them for diabetes, there was never all this controversy about it.
Yeah.
When it is for a quote unquote disease, it was just fine and dandy. It's about 2017 when people started using it for weight issues that it became a big problem, a political issue. And then now all of a sudden you hear all those things about the long-term side effects. We've had it for 18 years that we have enough data that to say, of course, are there some possible short-term side effects? Yes, like everything. You got to weigh the pros and the cons, and there's a way to mitigate the side effects. But the overall long-term side effects have been shown to be minor. And actually, every 2 or 3 months, there's a new study that's showing improvement in heart disease, improvement in kidney disease, decreasing risk of Alzheimer's dementia, decreasing inflammation, less risk of cancer. And the list is going on and on and on. So the GLP-1 are a gift that keep on giving.
So true.
Wow.
It's so true. Look, you're an evangelist too.
I know.
I
Rudy's an
see.
evangelist,
And very
y'all.
early adopter.
He
Yes.
was an early adopter. That's right.
That's great.
There's more coming on the horizon.
I
There's
know.
a
Very
trickle.
Oh
exciting.
yeah, there is.
That's going to come out. So the future of medicine when it comes to this is bright. And, to take a step back is what we're seeing, unfortunately, despite us really knowing the ins and outs of nutrition, right? Rarely do I see a patient come to my clinic and say, I don't know what I should be eating. Patients will tell me, I know exactly what I should do. I could write a diet book. I know the theory. I've tried it all. I've read it all. I just can't get myself to do it. And this is when we start talking, is this willpower or is this really a disease? And that's where I'm so glad that they reclassified obesity as a disease, because there's so much that comes into it. Most people who come in my clinic, they are type A personality, amazing people that the one thing that they cannot control is their relationship with food. And then now, as you said, you put them on a medication and all of a sudden you can control it. That says it was a hormonal issue. It was part of a genetic issue that we're able to change that and now bring the power to the people.
Yes. Love it.
Love that. Yay.
That's amazing. Well, you kind of touched on all of the things that I was going to ask, but I think we should reiterate this because
Let's
we want to
reiterate,
make sure
just in
everybody
case.
understands. You find your treatment is the whole spectrum, mental, physical, nutrition, hormones. Do you find that the whole picture of all of that and mental health is lacking in today's medical practices, especially with weight loss or, obesity treatment?
Yes, 100%. And the one thing with Western medicine, we've become so fragmented, right? There's a specialist for the tip of your finger, for your middle finger, and one for your elbow. And they don't talk to each other. We don't see the human being as a whole. Whereas, how did we grow as a species? We used to have shamans, medicine people that used to look at the whole picture, not only your physical health, your mental health, your spiritual health, and put all this as a holistic way of guiding you. Now
Yeah.
we've fragmented our care that you have a specialist for each one part of your body, and they don't talk to each other. That's why
Yeah.
first I'm glad I'm a general practitioner. I'm a GP. Actually, for me, GP stands for greater purpose, not just general practitioner. I'm a doctor of greater purpose. And my goal is to help
Aw.
people live their best life by utilizing all those different tools. And with all those tools that I have in my tool belt, we can help you achieve optimization in all of those different, whether it be nutrition, movement, sleep, hormone
Yeah.
optimization, mindset,
Sleep.
and connection. Those are my 6 layers to my wellness
Yeah.
practice.
Yeah, that's awesome. I love that you think about things that way because I don't feel like I think you're totally right. Like it's that you have a doctor that specializes in all these different parts and pieces, but nobody's like, maybe we should be a part of a care team and look at all these things together. And why do you think that is? Sorry, Branch. Why do you think that is? Like, why did we do that? Do we think it would be more efficient?
Yeah,
Like,
again, it's the
because it seems
fragmentation.
kind of dumb when you think about it,
Insurance
Yeah.
has been that in the country a lot.
Yeah.
Where I'm from in Haiti, you still have the family doctor who goes and takes care of the whole family, knows your whole history, comes
Yeah.
to your house. You pay him with a chicken sometimes when you don't have money, and he's part of your family. But unfortunately, we've fragmented the care. That has its advantage. When it comes to acute medicine, this has an advantage because, as you were saying, if you need somebody for a specific area, there's no place like Western medicine in the US that you will find a specialist for this one little issue that you have. But the
Yeah.
big vision, the big picture health, I think we're not doing well enough for it. So my type of specialization, I do functional medicine, integrative medicine. We call it now lifestyle medicine. To me, this is what we need, more soldiers like this to really go out there and show that there is a different way. And what's important, you talk a lot about this, medical gaslighting. It's
Yeah.
real. And it happens even more to women, where healthcare practitioners don't pay attention to what women have to say. And we tend to dismiss it. It's in your head. You're stressed. It's your hormones. Here's some antidepressants. Leave me alone. I have 25 patients to see after you. And this is such a disservice to our community, where medical gaslighting is real. And when I sit down with my patients, I take time. I look at you in the eyes. If we do a virtual consultation, we take time to really get to know, okay, what are your goals? What have been your obstacles? What has worked for you? What has not worked for you? And tell me how you are, how you truly are. Not just a cursory, how you doing? Fine. Let's go over what you. So by doing this, you bring in really true care. Not easy to do. I don't take insurance anymore because I did not want to stay in that every 15 minutes you have to see a patient.
Yeah.
And unfortunately, physicians get caught in that wheel, in that race, that sometimes most physicians go into this to help people. But after a certain time, you see physicians get really discouraged and resentment because they're in a bad system.
Yeah.
Yeah.
Like teachers. Like
Yes,
teachers too.
yes.
Yeah,
When you
I
think
totally
about
agree. I mean,
medical,
go ahead,
yeah.
Kat.
I was going to say, when you said about medical gaslighting for women, there's this TikTok rolling around. Bourbon RX posted it today. Did you see it? Where with the pharmacy benefit managers, what would the makers of we call it sexual enhancement drugs?
Oh,
They'd be up in arms with the kind of approval that us GLP-1ers would have to go through now to take that drugs. He's like Schmaregra.
well, then Vicki was saying that too, right? She was saying
Schmaregra.
that she kind of got to the point where she was trying to choose female doctors because she was like, maybe they won't gaslight me as much, right? Because like you, I mean, I think a lot of women do that. I think a lot of men do that too, for different reasons. And I think a lot of times we assume that because someone is a particular gender that they will understand our bodies a little bit better and maybe not blame us as much. But honestly, I've had women do it to me. I've had men do it to me. It's kind of an all over thing. And I do think this issue with insurance, like, is something we've continued to see. Everybody knows it sucks, right? But I think everybody used to have like these days where you had these, amazing retirement plans, and like people worked for like IBM Big Blue and like those kinds of, that day's over. That's over. And like most great health insurance is like something of the past. And I wonder what we're doing. Do you know what I'm saying? Like we pay all this money to the health insurance company, and they're screwing the patients and they're screwing the doctors. So I can see why this has morphed into let's just cut them out, which of course makes it hard for the patient, because patients are paying that health insurance because we think that we need to pay for the best plan to cover our GLP-1 medications or whatever it is. And honestly, like most of the time it doesn't. Most plans don't cover it,
No.
It's really frustrating. I can see why you would have moved that way, especially like any kind of weight focused, but anyway, sorry.
I'm not mad at it.
I think
You're not mad at it. Yeah.
No. I mean, but from someone that has type 2 diabetes, and obesity, even with type 2 diabetes, and that's, sometimes I think that the perception is, oh well, the diabetics, which I'm just like,
sure,
the diabetics can like get it. And I'm just like, that's not necessarily true. Insurance companies, pharmacy benefits managers are coming for us too.
Sure.
I have type 2 diabetes. I had to jump through hoops. The ladies know. They lost my PA. I waited 3 weeks. I was on hold, and I'm hearing them click, 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 click. She goes, "Oh, here it is." What? Yeah. And it was so crazy. And by no means am I saying that, you all know that I believe that each disease should be treated equally, but the fact that overall we have to jump through these hoops for medications that treat disorders is beyond sad. So thank you.
And JT has said plenty of times before, like, if someone had given her this medicine, knowing that she's predisposed, knowing that she was ultimately probably going to get type 2, she would have done it. She would have taken it early.
Oh my gosh.
Because it's awful.
If I may say something, we need to stop saying that GLP-1s are diabetes medication. They're not.
Yes,
Insulin is diabetes medication because it only works for diabetes. So GLP-1 medications, they target a hormone called incretin. That's in the blood. And yes, they saw that it increases your own secretion of insulin. And the first application was towards diabetes. But it's not a diabetes medication. It's actually a metabolic medication that really improves metabolism. And you can see insulin resistance is a spectrum. And insulin resistance is the biggest contributor of chronic disease and mortality in our society. Because insulin resistance starts with increased visceral fat, increased belly fat, that has many components. Some of this can be genetic. Now we're seeing that there's toxins, chemical toxins, environmental toxins, endocrine disrupting chemicals called obesogens, something like glyphosate in Roundup, that if the fetus or at any point you expose to this, it slows down your metabolism and puts you into that spectrum of insulin resistance. So sometimes no fault of your own, you find yourself in that spectrum. And that spectrum goes from even minor weight gain, like you were talking about some of those people who have 10, 15, 20 pounds to lose. Would they benefit from this? Of course. They have the lower end of the spectrum. So the spectrum goes with increased body fat, mostly visceral fat, the belly fat. Then you got insulin resistance, where your insulin is up, your blood sugar is still okay. Then you get pre-diabetes. Then that goes into diabetes. Then that goes associated with it fatty liver, which is becoming an epidemic in our society. Then even cardiovascular disease, heart disease, then stroke, and eventually Alzheimer's dementia. Alzheimer's dementia was categorized as type 3 diabetes. So it is all related to insulin resistance. And now we finally have a tool that can be so effective on that whole spectrum.
Wow.
Yeah, it's awesome. Love it.
I'm
so glad you're here.
not a diabetic drug.
Hallelujah.
Mind blown. Mind
Sorry, Kat, go ahead.
blown.
Yes. Oh, we'll go back to my questions. This was
Oh yeah, go to questions.
I found this in one of your I believe it was one of your TikToks. I wanted you to kind of expand on it for us. We all know that on our GLP-1 journeys, a lot of us are starting to do some strength training or getting introduced to it. Besides us knowing, or I've been taught that it helps increase your bone density, increases, let's say, mental health. But could you go a little bit deeper as far as like what really happens when you start strength training with the endocrine system, neurologically, mental health, all that good stuff?
Definitely. So first, one of the criticisms of GLP-1, which can be true, is that they are so effective at helping you lose weight that eventually you can lose muscle mass. And they've noticed that some people can lose up to 40% of their body weight when they're losing the weight. It's from muscle mass, which is a difficult problem because one of the most important determinants of aging, it's not your cholesterol, it's not your blood pressure, it's your muscle mass. So it's been shown that muscle mass and what we call sarcopenia, losing muscle mass as we age, is the worst, and it's the worst aging factor and associated with morbidity and mortality. So at any point of your life, you want to maintain muscle mass, but it usually is difficult to lose weight and keep muscle mass. And that's why when people embark on the GLP-1 journey, I tell them, resistance training, weight training becomes one of the most important things you can do. Getting the right amount of protein so you can support the protein synthesis, the lean muscle synthesis, it's the most important thing, because no questions that with GLP-1s, you will lose weight. Some people lose faster, some people take longer to lose, but the studies are very good. Most people who stay on it 1 year, and in my practice, because we preach a lot of nutrition and you know what to do, in 4 to 6 months, we have patients losing 40, 60, 80 pounds. The results are crazy. But if you're not careful at this time, you will lose muscle mass. And you want to kind of find a way to mitigate this. And Kat, that's what I love what you're saying. At some point, GLP-1s, you're not going to lose all the time and disappear. At some point, you kind of reach kind of a plateau, or the weight slows down. At this point, this is when you want to focus on size, right? You're losing inches.
Yes.
You're losing body fat. You're gaining lean muscle mass. Like Vicki said, especially with Mount Jao, because it is the latest version that also has a fat burner, the GIP receptor. You just feel good. You have less inflammation. So sometimes focusing not on the scale and focusing on those other things is really important. And my God, when you put in some more muscle, look at you, Kat, showing those guns.
Oh yeah, that's very athletic.
Better,
Yes.
right? And you move better. You can bend down and pick up things. You can move. You feel great. When you look at yourself, you see that for the psychological benefits of it, it's amazing. The metabolic benefits of it. Muscle is one of the most acting endocrine organs that we have. The more muscles you have, the faster your metabolism. The more muscle you have, the more your body can absorb sugar. So it takes sugar and transforms it and stores it in the muscle. So
It's Halloween candy season.
Oh, I was thinking your wine, Kat. I was like, hell yeah,
No,
Kat, you be
yeah,
getting another
I'm
glass
just
of wine.
I know.
Next week, all those
It's good
kids
for your
and all their
heart out here.
candy.
Yeah.
So let me go over something that I preach a lot also when we talk about wine. Listen, we all have to choose our poison, right?
Sure.
And we know that alcohol, all the studies are coming up that there's no benefits to alcohol. This thing of drinking wine for heart benefits, if you want to drink wine, take resveratrol, eat grapes if you want those benefits. The studies are really showing that alcohol at any level is not good for us. And men versus women tend to have a lower window of toxicity with alcohol. It takes less alcohol to really induce any kind of hepatic liver necrosis or fatty liver. So we've normalized in our society the drinking of alcohol. We've normalized mom wine, wine life, mom life, drinking wine, which, you know what, I understand that. But most people who take a GLP-1 will notice that they drink less.
Sure. Yeah.
It's actually being studied for alcohol use disorder. And why wouldn't we use that to help us decrease our alcohol intake? Because we know that long-term it can have side effects. So I have a few patients who come to me. They don't take the GLP-1 for weight. They take it because they drink less with it, and they are able to maintain a healthier relationship with this. And I'm all for it. It's not just for diabetes, even for weight, even to help you with this. That is a well-deserved function of the GLP-1s.
I do feel like it needs its own category. I don't even like that it's in the weight management category with like phentermine and crap. Like I think that's absurd. Like I wish they would work on that. And I know everybody's like, well, it's easier to work within the guides you have, but maybe it's time to break out of that, because clearly like this medication has broken out of everything anybody really thought was possible for certain for
There's
me.
another interesting study that came out the other day. A heart failure, patients with heart failure, especially what they call heart failure with preserved ejection fraction. This is when your heart is working fine, but you short of breath, you cannot function properly. It is a big problem, and they saw that obesity was a cause of this, not an associated factor, because it's like your heart has to pump against arteries that are getting closed up. And they saw that they studied specifically semaglutide, Ozempic, and they saw that those difficult to treat heart failure patients would benefit from that medication at whatever weight, whether you're 10 pounds overweight or 100 pounds overweight. So again, now I'm saying, so for the detractors of that medication who say you only have to be morbidly obese or have diabetes to take it, what if I have a patient who's only 5 or 10 pounds overweight that gets the benefit of heart failure? Are we going to, listen to that term, are we going to tide shame that patient?
No.
No, let me say.
No, Dr. Rudy.
Did you hear that?
No, we're not.
So all the medications, I call them the tide medication, right? It's semaglutide, tirzepatide, liraglutide. So the medical gaslighting term is tide shaming, because a lot of people will tell you that, even doctors will tell you that. Oh, you need to do it naturally. What's your willpower? Oh, no, you don't need that. That's cheating. I'm so against that. And I'm going to say something, and I'm going to get flack for this. Did you ladies
Not from us.
I love it. Did you listen
say it.
Oprah's interview when she talked about GLP-1?
Yes.
Yeah.
I loved it. We
did a whole round table about it for 3 hours.
I'm going to tell you what I liked and what I didn't. So I love that she brought that obesity is a disease, that she brought amazing physicians, and all of them were female, and really put it in a context that we understood it. She brought the discussion under a lot of compassion and empathy and a lot of scientific knowledge, which I loved. But Oprah said something that I did not love. Oprah said for her, taking Ozempic would have seen that she's taking the easy way out. Yeah. And I think we need to take this rhetoric out. This is not an easy way out. It's not
easy. No.
It's not easy.
But if we can use a tool to improve metabolic function and help your disease, and now turn you into, like a healthier version of yourself, I don't like that term, because a lot of doctors still use that. You can do it the natural way. Come on, you can do it. Just eat less and exercise. Yes. Why not use that amazing tool and remove the stigma? Stop tide shaming.
Yes, I love it.
Shaming, yes.
All right, Lydia, who helps edit, we're going to get a hashtag. Stop tide shaming. Love it. Let's make it viral.
Yes.
Let's do.
And I'm here for the clinical side, so I'm going to throw a lot of clinical words at you. There's another condition. They just came up with that condition because we've seen, again, it's called the metabolic syndrome. When you're part of that insulin resistance, which is usually associated with increased visceral fat, increased waist size, abnormal lipids, mildly increased blood pressure, and usually this affects your kidneys. And eventually can get you into kidney problem, liver problem. So they have a new condition called CKM, cardiovascular, kidneys, and metabolic syndrome. They're all interrelated. And guess what? Guess which medication has been shown to improve that?
Tides.
GLP-1 tide medications, baby.
Right.
You totally served up that softball.
Another study called the FLOW study. They looked at patients, whether they have diabetes or overweight with kidney issues that were ready to go into dialysis. They showed that when they put them on semaglutide, they have less risk of going into dialysis. The study was stopped prematurely, I think last 3 weeks ago. It was supposed to start in 2025. They were like, oh my God, this medication is saving lives. People don't need dialysis anymore. Yeah. You know what went down? The stock of the dialysis company went down. And I was like, yes, it's a victory for the people.
What's the name of that
Dialysis is
company? What is it
awful.
called?
People want dialysis,
DaVita. Yeah.
right?
Yeah.
Davina, exactly. So amazing.
My
Here's a
dad
quick
is a type 2 and is in kidney failure, and he's on Ozempic. They just got him to 2 milligrams. So, no, my dad has, I'm pretty honest about it, has leukemia. So it's kind of another thing. It's just all hard. But we've seen like a big difference in his sugars, and he seems to be like sleeping better and just all these different things. And he doesn't have to do insulin anymore, which is great because he was like on all the other ones before, and the Ozempic has really, really helped him. So but for those that don't know, Ozempic and Wegovy are semaglutide or semaglutide, however you say it. Depends on who it is, I guess. But yeah, so that would speak to that, right? So I'm very hopeful that that's at least one thing we won't have to deal with because he's still pretty young. He's like only he's like late 60s,
I'm
So
53. We have a good 40 years left.
yeah, I think it's very young. I don't know. Maybe it's just because I'm older, but like we live so much longer now. I feel like late 60s is really young.
Really young.
Yeah.
Let me tell you about a few other studies that are amazing. So
Yeah, let's do.
another study with the economic impact of this medication.
Mhm.
And they've seen that people who take GLP-1 medications, they looked at them for about 6 months. They decreased their consumption of processed food by almost 75%. So the fast food industry, the snack industry is breaking out. Actually, the CEO of Walmart, the CEO of Cheez-Its, those horrible snacks, Kellogg's, came out and said, and I'm going to quote, looking at our bottom line, and if those numbers continue, we will mitigate it. Meaning, in my mind, what they're going to do, they're going to start putting disinformation campaign against those medications and push the side effects so people don't take them.
Sure.
They make more money when we eat unhealthy. How crazy is this?
Wow.
It is crazy.
I can see that. All right. I wonder if they're doing it already.
Oh, I'm sure that they are.
Sure.
Oh, I think that they are the CEO of a snack company. Nestle. They're now trying to make snacks to partner with GLP-1s.
Maybe they should put some friggin' protein in their snacks.
Nestle bottles water. They have, healthy.
Yeah.
So.
Sure.
Well, I'm going to tell you, I'm hoping that this was a good reaction from Nestle because they're seeing the writing on the wall. Consumers, we have to demand better products. So if Nestle makes a better product, I want us to use those better products.
Yeah.
Those bad products out there, we want to empower people to stay away from them. And when somebody goes into this health kick of a GLP-1, all the things you know you should have been doing becomes easier for you to do.
Yes.
Right?
Because you're not sick. Your brain's not sick anymore.
Yeah.
Right? Like that's the problem is your brain will always fight you. When you have one of these disorders, that's what we're learning from the doctors.
Yeah.
On the show. Like it's I have been on a diet perpetually twice a year since I was 8. And I eventually just get like the BED. We can say it on YouTube. They're okay with it, but actually they promote content that's around treating binge eating disorder, which is really cool. But the binge eating disorder just continued to get worse and worse and worse and worse with me. And it's one of those things where it's like, no matter what I did, I would lose the weight. I could lose like 30 pounds. Right. And then before I knew it, I couldn't stop eating again. I couldn't stop, and I would look at my life. I'm going to try to get upset, but y'all know it's a day for me. I would look at my life and I have wonderful friends, clearly. And amazing family and a very successful career outside of this hobby. But it was like, it didn't matter because I couldn't control something as simple as my food, no matter what I did. And like the healing that I've done from recognizing that was chemical, biological, however you want to look at it, because the minute that this got done, all of those things that I've always been able to do and apply, they stuck, right? They just stuck. And it wasn't because I all of a sudden grew more willpower. I've always been a badass, always. I just couldn't apply it here because I didn't work right, And like, I have to tell you, and I made a TikTok about it, legitimately, especially now that I've become a part of this community, I have not in this community that deals with obesity, right? And in whatever it may be, because of type 2 or insulin, like whatever it may be, I have not met one person that is fat and lazy. Not one. They are the most entrepreneurs, and even the ones that are like kind of wallflowers, they're in it with the community and helping and doing and going and moderating and all these different things. They're all badasses. They are. Like, one of the stupidest things people did was make fat people better. I'm just saying, like, look out world. We're coming. I need to sleep. Sorry. Hallelujah. If you're interested in understanding GLP-1 medications like Ozempic, Wegovy, or Mounjaro, then join us on the Plus Sides, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, or Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sides, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together. The Plus Sides Podcast, because every story deserves to be heard, every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides Podcast. You're not alone. It's not your fault.